Let's all take a look at this research paper together. The title of the paper is Immune and Inflammatory Mechanisms of Cardiac Preconditioning RIC, a narrative review. Hello, everyone. Today, I want to talk about a unique healthy medicine called remote ischemic conditioning, RIC. Although it sounds technical, the principle is quite simple. It involves temporarily stopping blood flow in a part of the body for a short period and then restoring it. This small challenge triggers the body's protective mechanisms, helping to safeguard the heart, brain, and even other organs. The core function of RIC. It suppresses excessive immune and inflammatory responses, helping the body maintain balance. This is especially beneficial for conditions like heart disease and stroke. In other words, RIC acts like a way to cool down the body, preventing inflammation from causing excessive damage to organs. Research evidence. RIC has been proven to reduce damage in heart and cerebrovascular diseases. Particularly in stroke studies, RIC helps the brain become more resilient and reduces damage caused by inflammation. Potential future applications. Scientists are exploring whether RIC can be used for systemic infections and inflammation, such as sepsis. If successful, it could become a new treatment method to help many inflammation-related diseases. Advantages of RIC. Convenient and safe. No surgery required and minimal side effects. Cost-effective. Simple to perform and easy to promote. Multi-organ protection. Benefits not only the heart and brain, but may also help kidneys and liver after transplantation. Research findings on RIC. In heart disease, studies show that RIC can reduce damage caused by myocardial infarction. In cerebrovascular diseases, RIC enhances brain resilience, lowers stroke risk, and improves blood flow. Recent research even suggests it may help with hypertension and inflammation after organ transplantation. The role of RIC. RIC is a simple and safe technique that involves inflating and deflating a blood pressure cuff on the arm to temporarily block and then restore blood flow. This brief challenge activates the body's protective mechanisms and reduces inflammatory responses. Research has shown that RIC can decrease brain damage caused by stroke and improve long-term neurological function. Scientific evidence. Animal studies indicate that RIC reduces inflammatory molecules and prevents excessive activation of immune cells. Its protective signals may be transmitted through extracellular vesicles in the bloodstream, helping to suppress inflammation. Human studies have also found that in patients with cerebral artery narrowing or those undergoing stent treatment, RIC reduces new brain injuries. Recent large clinical trials demonstrate that acute stroke patients receiving RIC have a higher rate of good neurological recovery after 90 days. Future possibilities. RIC not only reduces brain damage after stroke, but may also lower complications such as post-stroke pneumonia. Scientists continue to research to better understand its mechanisms and identify reliable biomarkers, aiming to expand RIC's clinical applications. Summary. So, remember, inflammatory responses after stroke worsen brain injury. RIC is a simple and safe method that helps the body activate protective mechanisms in advance. It has the potential to become an important adjunctive treatment for stroke, helping patients recover better and faster. Future possibilities. RIC not only reduces brain damage after stroke, but may also decrease complications such as post-stroke pneumonia. Scientists are continuing research to better understand the mechanisms and identify reliable biomarkers, aiming to expand the clinical application of RIC. Summary. So, remember, the inflammatory response after a stroke worsens brain injury. RIC is a simple and safe method that helps the body activate protective mechanisms in advance. It has the potential to become an important adjunctive treatment for stroke in the future, helping patients recover better and faster. Scientific evidence. Animal studies have shown that RIC can reduce inflammatory molecules and decrease the overactivation of immune cells. Its protective signals may be transmitted through extracellular vesicles in the bloodstream, helping to suppress inflammation. Human studies have also found that in patients with cerebral artery narrowing or those who have undergone stent treatment, RIC can reduce new brain injuries. Recent large clinical trials indicate that acute stroke patients receiving RIC have a higher proportion of good neurological recovery after 90 days. Future possibilities. RIC not only reduces brain damage after stroke, but may also decrease complications such as post-stroke pneumonia. Scientists are continuing research to better understand the mechanisms and identify reliable biomarkers, aiming to expand the clinical application of RIC. Summary. So, remember, the inflammatory response after a stroke worsens brain injury. RIC is a simple and safe method that helps the body activate protective mechanisms in advance. It has the potential to become an important adjunctive treatment for stroke in the future, helping patients recover better and faster. What is sepsis? Sepsis is an uncontrolled bodily response to infection that leads to systemic inflammation and even organ failure. During sepsis, immune cells release large amounts of inflammatory molecules, such as TNF-alpha, IL-1 beta, IL-6, which can cause temporary or fatal heart failure. When heart function declines and blood flow is insufficient, it accelerates inflammation in organs throughout the body, potentially resulting in multiple organ failure. Animal studies. In sepsis models using mice and pigs, animals treated with RIC showed higher survival rates and better heart function. RIC reduces inflammatory molecules in the blood and lessens the excessive attack of immune cells on organs. Additionally, it improves microvascular circulation, providing organs with better blood flow and oxygen. Preliminary human research results. In intensive care unit patients, RIC has been used to enhance microvascular circulation. Initial findings indicate significant improvement in blood flow indicators after the first use of RIC. Large clinical trials are currently underway to determine whether RIC can truly reduce mortality and organ failure caused by sepsis. Sepsis-associated encephalopathy. About half of sepsis patients experience brain dysfunction, such as confusion or memory problems. Some individuals may continue to suffer cognitive impairments for years even after recovery. The anti-inflammatory effects of RIC may help reduce these neurological complications. Many severe COVID-19 patients also exhibit similar brain issues, suggesting that RIC could potentially serve as a protective approach in the future. Key takeaways. Sepsis is a dangerous systemic inflammatory response that can lead to heart failure and brain complications. RIC is a simple and safe method that helps the body suppress excessive inflammation, protecting the heart and brain. In the future, RIC has the potential to become an important adjunct therapy for sepsis and related brain disorders, helping patients live healthier and longer lives. Summary. RIC acts like a protective drill for the body, using small challenges to blood flow to prepare the body's defense mechanisms in advance. It helps reduce disease damage, boost immunity, and even slow aging. Moving forward, RIC may become a simple and effective wellness method to help us live healthier and longer lives. Do people truly believe that healthy medicine and RIC can promote wellness? Hurry and purchase a healthy RIC sphygmomanometer to enhance your health every day. Don't forget to scan the QR code. Thank you all for watching. I am Dr. Andrew Shu Lee. Until next time.